for the introduction. Mrs. Vinuta Raju is our executive manager. Thank you, Mr. Chidanand, for giving me this opportunity to talk, to specifically talk to the residents of the ALPS apartment and all my guests whom I've invited over here. Thank you so much. So we all know that eyes are precious, and we also know that we are amidst a pandemic. But friends, I want you to understand that essential eye care services cannot be postponed indefinitely. You need to know what is important, in which circumstances you should go and meet an eye doctor, in which circumstances you can take a telemedicine appointment and meet us, and when you should just stay put at home and not go outside the house. So there are small minor problems which you can just do home remedies, but there are certain problems of the eye wherein which if you are not do not approach the eye hospital in time, there is always a risk of losing your eyesight. So today I will be throwing light on those aspects also, besides of course the topic of today, that how digital devices can harm your eyes and your body and what steps you can take to prevent that harm. So welcome once again to this webinar, and thank you for your precious time in advance. I would like to first start with saying that a lot of people around us are in a lot of psychological trauma due to multiple reasons during the pandemic. So the pandemic is a time of our lives where we need to be a little more kind and a little more helpful to others. Please be mindful of that. We should also stand together against the COVID-19 stigma, right? People who have recovered from COVID-19 or who are under quarantine or in whatever stage of COVID-19, the fear and stigma of COVID-19 is something which we should deal with. Of course, we should be careful of transmission, but we should understand the science behind the transmission and not unnecessarily kind of create a stigma out of the patients who have recovered from COVID-19. So please be mindful of that. And remember that after 14 days, the COVID-19, when the RT-PCR is negative, in fact, after 10 days itself, there is no way in which the patient can transmit the virus anymore. So we at Zamindar's Microsurgical Eye Center, when the COVID pandemic hit us, we like in these are the picture of our happy times before pandemic. We could not hold hands anymore, but we decided to hold hearts and move ahead with a complete team. We are happy that all of us are with us. We were able to sustain all our staff, and we are moving together with holding hearts. So like Sir Thomas Carlyle said, that our main business is not to see what lies dimly at a distance, but to do what lies clearly at hand. Definitely the pandemic is a time in which you should live in day-tight compartments. Think only about today and today, that's it. Don't worry about tomorrow, what can happen, what not can happen, when will the pandemic end, what will happen. Just do what you can do at the best today. And this year, 2020, if we just come out of the year safe and healthy, that should be our profit. So like Mrs. Vinuta Raju told you, that together we are one of the first hospitals in India to achieve the WASH certification, that is Workplace Assessment for Safety and Hygiene by Quality Council of India. All our systems and protocols, both in the outpatient and in the operation theatre, are safe against transmission. So this is one thing which of course all of you know, but I would like to once again stress on this, that like how Dr. Atul Gawande, an Indian scientist sitting in Boston, at the beginning of the pandemic itself, he told us that all safety measures together only will work. Hygiene measures, screening, distancing, and mask. If I see a lot of people, of course, no, on the streets, they don't wear masks, but if they are wearing mask also, the mask is not worn correctly, or if they're worn correctly also, there is no social or physical distancing of 2 meters. Remember, my friends, each of this measure has flaws. So if you skip one, this is like a drug cocktail. It will not work. All the 4 things, hygiene, screening, distancing, and mask, when taken together, can only keep you safe from transmission. And also remember that this is a very new virus. Doctors also don't know much about it. How it will behave in your body, even if you're young, we really don't know. So I will now come to the core topic. There are certain things which you might suffer during the pandemic, and you will be thinking whether I should go to the eye doctor. What should I do? Now, suppose if you develop a conjunctivitis like this, a red eye, if you do not have any decreased vision, close the other eye and see if the vision is affected. If the vision is clear, if there is only red eye, you can just end up putting lubricant drops, plain lubricant drops, something like carboxymethyl cellulose, and that is something which will take you through. Do cold fermentation. If there is no pus or yellow discharge, typically this could be a viral conjunctivitis, not necessarily COVID. Any viral conjunctivitis can look like this. So if after using a lot of lubricant drops, plain lubricant drops every hourly for 2-3 days, if you're still not relieved, then maybe you can go and meet your eye doctor. But remember, the eye drop bottle should be a new bottle, right? So many times I've seen people that and just because they really are not aware that once you open an eye bottle, you have to actually use it within 30 days. If you're not using it within 30 days, it can get contaminated and can be more harmful. So even if the expiry date for the eye drop is after about a year, you have to throw away the eye drop once you've opened it within 30 days. Something like this, this is like an internal hordeolum, like a boil. Now this, you need some hot fermentation and some plain antibiotic drops like moxifloxacin or ofloxacin. See that no steroid is given. Steroids are like dexamethasone, fluoromethalone, prednisolone. These are steroid drops. Please see that steroids are not used. Always check in detail. And a plain antibiotic drop can be used if you do not have any allergies. Do hot fermentation for such conditions. And wait for a couple of days. If it does not resolve, then you should go and meet an eye doctor. Maybe you need an oral antibiotic tablet also. Importance of remembering that steroid should not be put, because steroid drops put without the doctor's knowledge can cause a lot of side effects in the eye. It can cause corneal ulcers. It can long-term steroid use. I have seen some small children putting steroid drops for a very long time for allergies, and they end up having glaucoma and cataract. So please remember, whenever you are looking at an eye drop, is small request, please do not buy from the medical store. Always involve an eye doctor and then put eye drops. The only drops which you can maybe take from on the medical store is only a plain lubricant drop, which is safe to take, or a plain antibiotic drop in a case of an emergency. So these are the symptoms of dry eyes, especially if we will be talking about digital devices. But if you have blurred vision, irritation, sensitivity to light, or eye fatigue, scratchy eyes, or feeling like rubbing your eyes, this is typically of symptoms of dry eyes, especially if you're exposed to digital devices for a long time. And for these, you can use lubricant drops. You will have to cut down your amount of digital exposure, and we will also tell you how to make your digital devices safe for your eyes through this talk. Friends, cataract is something which is not an emergency, but if you have elderly people at home who have, who have really blurred vision and who are not able to see, then it is a better idea to get their cataracts done even during the pandemic, because if they fall and they get hurt, if they develop a fracture or something, that's going to make their life more difficult. Or if there are young people who have pushed some kind of cataract which gives rise to glare. Now this glare is something very dangerous, especially if this gentleman or this lady is driving in the night, and this can give rise to distorted vision, and this is dangerous. So if your quality of life is compromised because of the cataract, then you need to get a cataract surgery done. And like Mrs. Vinita said, we are doing safe cataract surgeries. By the grace of God, all our safety protocols are in place. So just to give you a brief on that all modern cataract surgeries use a high frequency ultrasound device that breaks up the cloudy lens into small pieces, and it's removed through a 2.2 millimeter incision. What we call it is a micro incision phacoemulsification cataract surgery. This does not require hospital admission. It is completely bloodless and sutureless, and it is done with only eye drops, anesthesia eye drops. There is no injection required for this kind of surgery in most of the patients. Now, this is something, what we call it as a silent thief of vision, glaucoma. It refers to a group of related eye disorders that cause damage to the optic nerve. And why it is known as a silent thief of eyesight? Because initially, when the damage is happening, it happens in the periphery of the vision. And you will not realize also if you're having glaucoma and if you've not got yourself checked. So this is something which is very important, that you need to meet your eye doctor if you have a family history of glaucoma, or if the patient is already a glaucoma patient, then do not wait for the pandemic to end. Please go for your regular checkups and see that the glaucoma is under control. Diabetic retinopathy. All patients who are diabetic should definitely not miss their appointment, because this kind of a fundus photograph, now we take it through the small pupil only. We don't need to dilate. Most of the times we reduce the number of amount of waiting time in the pandemic, and we take fundus photographs or retina photographs through small pupils to look at the central fundus. Only if you find that there is something wrong, then we do a dilated pupil examination. So this is a very quick test. It takes hardly 5 to 10 minutes. But if you're diabetic, please do not wait for the pandemic to end. Go and meet your eye doctor and get this tested. So I hope that you have enjoyed this video on floaters. See, these floaters or some mosquito-like thing, moving around in front of your eyes is a very common problem. If this has been there for a long time, or if it is only one, And if your vision is not blocked, then you should not worry. But if the number of floaters increase or there are flashes of light along with that, then this could be a sign of retinal detachment, especially if you have a family history of this or if you're having high minus numbers. And that is the time this would be considered as an eye emergency. So kindly do not wait for another day. Also see that you can contact your eye doctor as soon as possible. One more thing I would like to stress over here is that a lot of many of us might have recovered from COVID, and what we have found out is that COVID has some kind of a lingering effect on the blood vessels. It can cause branch retinal vein occlusions in the retina. It can cause retinal edemas. So people who have recovered from COVID, if you do develop some vision issues, kindly do not wait for a long time. Kindly immediately go and meet your eye doctors, because it is a known fact now that COVID a little later on can damage the retina, and early treatment is always the most important thing, especially for retinal diseases. So now we will, I hope you've understood by now that what were the conditions of the eye which can be treated at home, what can be, treated with the help of telemedicine. We also have telemedicine facilities. And for what conditions you definitely need to meet an eye doctor, an eye hospital, and it is safe. All safety precautions are taken, and it is safe to come to us and meet us in case if you fall in that category where you have an elderly person at home, or you're above 40 years of age, you had a family history of glaucoma. Do not even miss your routine eye checkups if you're diabetic or if you get increased number of floaters. So these are the common conditions of the eye, and I wanted to stress on that before I come to the topic of today. So let's now talk about digitized lives. Yes, this true? You must have already read this, what is on the screen, that we wake up to the glow of phone, we work all the time, and how actually it affects our eyes. It really gives you a lot of eye strain and headache, and what can you do about it? So now the COVID pandemic has added this work from home scenario, and how we are all stuck with this, but we have to think positive and find out a way out of this. Now, let me give you some basic facts. I'm sure most of you know about this, but at the cost of repetition, also, I would like to stress on this that there are something like radio frequency waves, and these are ionizing radiations that are absorbed by the body part that is closest to the mobile phone or laptop. Now, they damage the DNA of body cells and can cause cancers in the long run. Okay, friends, so remember this. Excuse me. Another thing what you need to know is that digital screens emit blue light, and the combined effect of blue light and radio frequency waves damages the ocular surface. It causes cataracts and retinal damage. So imagine the blue light and the radio frequency waves. It can cause cancers in the body, it can damage the ocular surface, cause cataract, retinal damage. So please understand that it's not just that, okay, so what, and everybody's doing it. We don't know what effect these kind of devices will cause after 20 years. We don't have that kind of a track record, right? For these devices, after 15, 20 years, there'll be a lot of research saying all these problems in the eye and body were because of this. We will have to be smarter and outsmart these things, and take precautions now only, right? So please be mindful. Turn off the phone or turn to airplane mode while going to sleep. Don't keep the phone in your pockets, as radio frequency wave travel through clothes to your body. Radio frequency signals are the strongest when the phone or laptop is being connected to a power source to be charged. Obviously, we all know that. Please don't use a phone when it is on the charging mode. And effect of the blue light is minimized by avoiding reading or watching screen in the dark. Typically, when you don't want to disturb somebody at home and all the lights are off and now you are with your mobile phone, kindly do not do that. So let's come and talk about this very, very well-known syndrome now, computer vision syndrome. It's also termed as digital eye strain. Now, the physical eye discomfort felt by many individuals after 2 or more hours of digital screen is known as computer vision syndrome. You can end up having dry eye, irritated eyes, blurred vision, neck and back pain. So this is looking familiar? Yes? Do you experience headaches, blurry vision, burning eyes, dry eye? Tearing is also a sign of dry eyes, mind you. And digital eye strain report. So this is the kind of digital eye strain report which was given before the pandemic. Now, after the pandemic, it has obviously become almost 90% for all categories. And there is something which all of you should know: the melatonin association with sleep. You are typically watching the mobile phone or the TV till the last time, and now you want to go to sleep. Isn't it true that most of the time you have to struggle for a while before you get the sleep? That is because there is a relationship between melatonin and sleep. And the blue light blocks the secretion of the hormonal substance secreted in your body known as melatonin. And the lack of melatonin disturbs our body clocks. It interferes with sleep, growth of children. It makes them agitated, restless individuals. It interferes with their memory and their learning. Remember? So you can understand it is not just the eyes which are getting affected. It is an overall growth, development, memory, learning, everything is getting affected because of excessive use of digital devices. So now we've already discussed the problem in detail, but I'm also here to talk about the solution. So let's talk about the 10 tips to avoid a computer vision syndrome. First, of course, get a comprehensive eye exam by an ophthalmologist. See that you do not have any minor refractive error also. If there is a minor refractive error, your distance vision might be clear, but you might be having issues in seeing, in eye strain and headaches, because you're constantly focusing on the screens or reading or doing concentrated activity. So you need to get a thorough eye examination done and see that any small problem in the eye is sorted out before you subject yourself to digital devices. Like, for example, this slit lamp examination in a young person showed that he has cataract. Cataract can happen in young people also. This is check for glaucoma, intraocular eye pressures. Of course, a refractive correction, like what I also said, that very minor refractive correction can also give you headache. So you need to get a thorough checkup done. And now, how do you minimize glare? That is the most important thing. If the glare is minimized from the screens, your strains will come down. So you have to reduce glare from walls and finished surfaces. Consider installing an anti-glare screen on your monitor. And if possible, paint bright white walls a darker color with a matte finish. If you can do that, that will also reduce the glare from the computer. Cover the windows. And adjust the lighting. See, avoid excessively bright light either from the outdoor sunlight, through the window, or harsh interior lighting. And reduce the interior lighting by using fewer light bulbs or use lower intensity bulbs and tubes. Make the room lighting to the brightness of your devices. Match the room lighting and the brightness of your devices. So obviously we all know that the overhead light should come from behind, and see what is the wrong position of overhead light and what is the right position of overhead lights. Upgrade your display. Most of us are using LCD displays, but if you are not, it is about time that we move to the LCD. It is really not certain when the pandemic will end, but at least we should ensure that the damage because of the pandemic does not stay with us even after the pandemic ends. So these steps are very, very important. Adjust your computer display settings, the brightness, the text size and contrast. Obviously, we all know that the white screen and black script is the best way of having settings, and when you want to read text for a long time. So this is a right and this is a wrong way of, even if there are teachers, we all know that this is the way in which they want to present something, they should use this kind of a script. And the color temperature, now the computer display settings, there are some technical aspects, but of course I would like to stress on that also, because they also play an important role in reducing your digital strain. What is the color temperature? Blue light is a short wavelength visible light that is associated with more eye strain than longer wavelength use like orange and red. And reducing the color temperature of your display lowers the amount of blue light. Remember, the color temperature, you need to go to your setting and reduce the color temperature of your display. This will reduce the amount of blue light emitted, and this will again prevent you from all the damage caused by blue light. So there are, of course, these blue cut lenses available, and you can try using them if you feel that you are really subjected to digital devices for a very, very long time. And please keep your surrounding area. If there are students watching here, please keep your surrounding areas around the computer very clean and dust free. Otherwise, pollens, allergies, all those things are added hazards of working on a computer area for a long time. And blink, blink, and blink more often. It is free, right? We can all blink. So why now? Somebody will ask me that why blinking is an unconscious. Yes, it is. If you do it unconsciously, right? Blinking, you just keep blinking. But when you're actually staring at the computer monitor, you blink less frequently. So you will have to remind yourself to blink. And that's very, very important, because with every blink, there is a redistribution of tears in your eyes, and you're able to, the dryness of the cornea is reduced. See, remember, my friends, that the central black portion, what we see, the cornea, is a bloodless structure. And the only nutrition with the cornea gets it from the tears. So the tears are very, very, very important. And you need to blink more often while you're working on the computer. One thing I would like to tell over here is that some people have a habit that they keep washing their eyes. They keep their eyes open and splash water inside your eye, in the eyes, to in order to have a cooling effect. Kindly do not do that. Okay, we already have, God has made our body and our eyes as perfect organs, and we need to just blink and the tears will get redistributed. You do not need to put extra water in your eyes, because that water is a tap water. You don't even know how good that water is. You are actually replacing this water, replacing your natural healthy tears with the water. So please don't do that. If you want to have a cooling effect, please close your eyes and splash water on your face. And this is important. Two things over here. The 20-20-20 rule, that look away from your computer at least every 20 minutes and gaze at a distant object at least 20 feet away for at least 20 seconds. And when you do that, your convergence muscles, there are these convergence muscles in your eyes which will relax, and your eye strain. It's like, imagine if you're going to the gym and now you're continuously doing your biceps. You're taking the weights and continuously doing. Is it possible to do that? So remember, friends, that when you are continuously staring at your computer monitors or your lap or your mobile phones, you're continuously using your convergence muscles, and they can go in for a spasm. You can end up having severe headaches. You need to relax them. You need to look away. So every 20 minutes, you should look away, do something else, walk out, stretch yourself and come back. So this is the 20-20-20 rule, the golden rule to avoid digital strain. And of course, take frequent breaks, to reduce your risk of computer vision syndrome and neck, back and shoulder pain. You need to do this. So this is what we all know is known as ergonomics, and it is a no-brainer that what is the right posture and what is the wrong posture. So let me go into the detail of the ergonomical or the ergonomic. Look at all these points over here. The top of the screen at eye level, ears and shoulders centered over hips, adjust chair to support lower back, adjust height so elbows are above desktop, keep wrists straight and arms parallel to the floor, knees should be at 90 degrees and the feet flat on the floor or footrest. Very, very important. The feet is flat on the floor. There are specially designed chairs also available. If you can afford, please go for that. And of course, food. You are going to eat. So you need to learn to eat healthy, Hence, don't forget to get your eyes checked by your ophthalmologist on a regular basis. And also remember that we do have children, and if we are not taking enough action to divert them from using excessive digital devices and encouraging them from other activities, these is the gloomy picture of the children of the future. Thick myopic glasses, stoop postures, poor general health and immunity, as they will be glued to screens whole day with no time to exercise or eat proper food, extremely introvert with poor social skills. Isn't it about time that we as parents or the adults in the family do something about it, not just for our family, but for our community? And the conclusion I would like to conclude over here is that we are the only ones who can put a halt or may even stop the doom if we all start working on it today. Because we know, we've had childhood without digital screens, and we've seen that is possible. Our children don't know about it. And today it looks like a digital device addiction. Tomorrow they will not even use the word addiction. It will become a necessity. And then it might be too late, my friends. So just remember that this pandemic will pass away. Things in life will not always run smoothly in our times, as in all times. And the great fact to remember is that the trend of civilization itself is upwards, forever upwards. This was said by Endicott Peabody in 1885, even before the World Wars. So even this difficult phase in our lives will pass by. We need to be strong, live one day at a time, take good care of ourselves, and create a happy atmosphere around us. We don't know who is under depression, and we can really help them by keeping our moods cheerful. So stay home, stay safe, and thank you. I thank you from my entire team at Zamindar's Microsurgical Eye Center. Thank you, Mr. Chidanand, for giving me this opportunity. And I'm going to open now the floor for discussion or question and answers.